So when we begin to discuss what we're going to do in the therapy session or how we're going to proceed with the process of resolving anxiety in your child, what we're going to do is we're going to begin by having the child come into the office with the parent or parents. And a lot of times this is a very natural and calming kind of atmosphere. The child isn't put on the spot too much, but eventually what has to happen is the child has to explain to the therapist, or at least this is the way I would do it. I would say, hey, do you understand or do you know why you're here to come see me? And the child may not know. And a lot of times that is, it's more common than you think. And it's no fault on the parents. I think a lot of times parents are really wanting to be very ginger and careful. They don't want to bring up the fears. So they say, oh, we're going to see a doctor about your fears. And it's like, oh gosh, you know, especially if they have a fear of adults or fear of being in public, or they're just overly shy. I mean, they don't want to intensify the situation. So about the only thing I get from kids is that I know that you don't give shots, and that's probably pretty good. So in essence, once I hear that maybe they don't know why they're in the office, then I might, you know, from my previous conversation with the parent, usually I give a 15-minute phone consultation, and I get the gist of what's going on with the child. I might say something like, well, you know how sometimes you're afraid of certain things, sometimes at night, sometimes you're afraid that somebody's going to come into the house and get you and those kind of things. Well, that's what we're here to talk about. I'm going to help you go through that and deal with those things. Does that sound okay to you? And usually the child is cool with that. And or if they lean into mom a little bit, like, hey, what's up? You let my secret out, but it's okay. The goal is to really get the information out in the open. So the next thing we do is I do an analysis of the fear. Now, that's not going to necessarily happen in that first session, but if it does, I'm going to move us to the idea of when this fear began, why this fear is here, like how often does this fear occur, what time of the day, is it at night or is it during the day? Sometimes I'll ask questions regarding who's around the person, and then I go into just really some of the thoughts that they're having. So we go through the process of really identifying, it's called the anatomy of the fear for me, and I'm really trying to figure out why they're feeling it. I'll also get into a discussion of their thoughts. That comes maybe a little bit later in the process, but eventually I'm going to understand that. And then I'm going to really try to dig in a little bit as to what they're feeling on the inside. So what are some of the sensations they experience? Now, it's not unusual for an individual not to know what's going on. The older they are, the more they're better at detecting what's going on inside of them. So it gives them an opportunity to at least share a little bit about what they're experiencing, where they feel it in their bodies, what are their thoughts associated with it. So once I get those things figured out a little bit, then we have a little bit of, we have the anatomy of the fear, and then we can move into dealing with resolving this. So that's what we're going to start with. So before coming in, let's say if you're bringing your child into therapy for anxiety, then what you want to do is maybe get to those things ahead of time, analyze that yourself, and then provide a little bit of help to the child as she or he is trying to explain what brings them into the office and to help with the process that we're going to begin with. Okay, thanks a lot. Another part to this is coming up, so stay tuned.